hypnotist. I have been in private practice for 4.5 years, and I've been working out of integrative health for about 2 months now. I work up here once a week, and I have a private practice in Colorado Springs. I got into hypnosis because I got sick about 7 years ago, and I went on a journey to discover what I needed to do and how I could help myself. And that's when I came across the concept of how the mind is so powerful in healing the body. And along that way, I stumbled across the concept of hypnosis, and I always thought, wow, how is that thing I saw on the stage? Didn't know it could help anybody. And so it sparked my interest, and the more I learned about hypnosis and what it really was, how it is a natural state of mind that just basically opens the doors to the subconscious mind so that we can change our beliefs about ourselves and the world around us and also heal our bodies, I became even more interested. So I went to school and studied and became a certified hypnotist, and then opened up my practice. The schooling I went to was in Westminster, Colorado. It's called the Eastburn Institute of Hypnosis. They are a hypnosis training school affiliated with the National Guild of Hypnotists. It's the oldest certifying body of hypnotists in the world, and it's a very comprehensive training program that teaches you not only the various techniques of hypnosis, but then more importantly, how to help people once they are in hypnosis and what to do. And any advice that I would give to anyone going into an integrative health and wellness career is not only be the very best that you can be with the profession that you go into and the modality that you choose to practice, but also get a very good understanding of how to build a business. If I could sit and do hypnosis all day long, I would love to. However, there is a whole business aspect of marketing and getting clients and keeping current on my profession, as well as just learning how to run the financials and taxes and all the business end. It's very, very important, and oftentimes they don't teach that much, especially they didn't teach it in my school. It's stuff I've had to learn on my own, but it's very, very worth it, very, very important, because you can't help anybody if they can't find you.
Hi, I'm Dr. Amanda Friedhoff. I'm a chiropractor in integrative health here in Greenwood Village. I just want to talk to you a little bit about chiropractic and integrative health as a practice. So I graduated in Life University over in Atlanta, Georgia. It is an 8-year degree. It does take a while, but it is very, very worth it. One of the things I like about my profession is that I get to see people as more of a mainstream focus, because chiropractic is more along the world than other things such as acupuncture, still starting to get some stimulation, but I can also introduce them as a gateway in our practice to things like, as mentioned, acupuncture, Chinese medicine, massage therapy, Vygotsky postural alignment, which by the way does not take that much after school to get, and a few other therapies. I also do a lot with nutritional therapy and counseling of Western medicine and Eastern medicine mixed together. So there's a lot of things that are just plant-based, homeopathics, flower essences that individually don't take a lot of training to do, but you match them all together. Perhaps, for example, our owner here is a massage therapist and an acupuncturist and does postural alignment and Chinese medicine. Each one of those professions he did separately. So he started, for example, as a massage therapist, and then later on got a client base, added acupuncture in, and just kept adding. And as a new student, I would definitely say that's my recommendation, is figure out what you want to do and then go try it. Before you even go into that academic spectrum, that course, before you say, I'm going to just run right up to acupuncture school, here's a check for $10,000, no, don't do that, don't do that. Find an acupuncturist, spend some time. I know that the interns that came and helped us, they spent a lot of time looking at acupuncture, looking at massage, watching chiropractic adjustments, watching some of the posture therapies, being part of it a little bit, which is a lot of fun. But definitely watch, play, touch, do, ask questions, get your face in it. Let's go, what's this, what's this? When I first graduated my first job, the chiropractor hired me and he said, I like you because when I was adjusting, your head was practically in my elbow and I had to say, back up, you're too close, you're too close. So that's the kind of fire that you really want to get. Definitely, I think this generation, we're told, oh, go be a nurse, or oh, go do medical prescription, or how do they say that? Transcription, excuse me. Billing, coding, the easy jobs, the desk jobs. Push past that. There's much more fun than that. You're going to be bored out of your gourd if you do that. You don't want to do that. It's not the end of the world if that's what you do while you're working on something bigger, but you have to have a passion every day. You go to work, you see people, you touch people. They're going to burst into tears. They're going to hug you. They're going to love you. The first time you get a Christmas present from a patient, you're like, oh my God, you just thought of me. Ah! Or they remember your birthday or the birth of their child. And it's really big being in their lives. So I would say go, learn, touch, figure out all the different types of professions that are available to you and the timelines, and see if you can stack them together. Because, you know, what I did was a little bit more challenging. I went out, I got my bachelor's degree, I did my doctorate, did it all, internship, jammed it all in a few years, and it took me a lot of time to get my groove post-grad. I've now been out 5 years. I would definitely say, had I gone slower, had I gone and become maybe an assistant, or learned what it was like to do billing or coding or greet at the front desk and then adding things during school, maybe taking a year in between bachelor and grad, you know, just really getting an idea, getting my feet wet, I would have gone farther. And it wouldn't have taken me so long to build up a client base. So just go as you can. Don't be afraid to ask questions. Be annoying if you have to. Tell me what's going on. What are you doing? What's that called? What's that called? What's that called? You know, be that person, because that's going to teach you what you want to know. And trust me, you'd rather figure it out while you're in school and you have student loans to spend and you have time to do it than afterwards. Trying to learn it after you graduate and possibly changing your mind and going to different courses is much harder than just doing it from the beginning. So thank you so much, and I hope you guys all have a great time doing whatever it is you do.
Hi, my name is Jerry Casados, and I'm a nutrition therapy practitioner, and I've been practicing for about a year and a half now. I've been at Integrated Health for about 9 months. I have my own private practice, and I just contract out of Integrated Health, which is a wellness center here that has acupuncture, massage, and a whole gamut of kind of holistic therapies. What sparked my interest about getting into nutrition is basically about 6 years ago. Because of my own health issues, I basically changed my diet to a plant-based diet, which is a vegan diet. I got off the cholesterol medications, got off blood pressure medications, lost 25 pounds, so that sparked my interest, and I basically went to a 10-day living program in Santa Rosa, California, to learn more about my health issues and how to better approach, change my lifestyle to a plant-based diet. So I specialize in plant-based nutrition, dealing with a lot of chronic illnesses. I treat diabetes, heart disease, any autoimmune diseases, and also weight management, and there's some cancer treatments I can do too. So I basically do meal planning, I do some cooking classes, I do nutrition counseling, nutrition education. I do also do some special programs for diabetes and heart disease. My schooling, my training came from, I went to a Nutrition Therapy Institute here in Denver. It's one of the better schools in the country for nutrition. It's did the 1-year program, which is a nutrition therapy practitioner, and I also got certified in plant-based nutrition through Cornell University and the T. Colin Campbell Foundation, which is basically just specializing in plant-based nutrition and all the learning about the chronic illnesses and how to treat them with plant-based nutrition. What kind of advice would I give the students that want to go into this profession? Just to get a well-rounded education in nutrition, trying to find the best schools and decide what kind of what direction you want to go. There's so many directions to go in nutrition. You can go into a private practice, or you can work for a healthcare system, or there's several different areas, and not just being a nutritionist. You can go ahead and be a registered dietitian, which is a totally different thing than nutrition. So it's just a little more schooling, but they're similar in their approach in some cases. So that's what I do. And,
My name is Brian Bowen. I'm the owner of Integrated Health. I'm an acupuncturist, a postural alignment specialist, and massage therapist. I founded Integrative Health in 2001 and have been at my current office for 6 years, where we purchased the building and expanded our clinic. I first got into acupuncture at a friend of mine in California who was getting ready to have a knee surgery, and his mom was into holistic medicine and suggested that he try acupuncture first before he had the surgery. 3 treatments later, he totally avoided the surgery. So at that time, I was 18 years old, and I was totally fascinated by the concept that you could, relieve pain by sticking a needle in a certain joint. And so I grew up in the Midwest. I'd never heard of such a thing, and so that started my interest in it. I didn't know that you had to go to school for 4 years at the time, so I tried to actually order some acupuncture needles, and they thought I was crazy. So later on, I went to massage school and started my profession there. And when I was in massage school, I developed a great passion for that And then one of my anatomy instructors happened to be an acupuncturist, and so he reintroduced me to the concept of acupuncture. So from there, I worked in an osteopath's office and then enrolled into acupuncture school. And then the great thing about this medicine is one modality opens the door for something else. There's not one right answer, there's a lot of right answers, and it's fun to collect and fill your toolbox full of all these great things. And then when somebody comes in, you have these different tools that you can break out and help identify what they need. Sometimes it's multiple things in what order. So you're never short on creativity. You never feel stuck in a corner where there's no growth. And so, having this clinic for a long time, I've worked with a lot of different practitioners, and so they've helped me grow, and I've got to see a lot of other modalities at work as well and how they can work in unison together. And so I just want to express, I think, that for any students, go and explore. Sometimes I've been trained in certain things like cranial sacral therapy that I thought was amazing, but it just wasn't the right thing that I felt in tune with. And so even though I went and trained with that, it's about exploring your options and seeing what kind of evolves. And a tool that you might learn plays a role in a different way later. So stay adventurous and really explore every option. And the other thing too is when you're in this field, just like any other field, it really does take some endurance, and you really have to be patient with it and work hard. Not only do you have to be a great practitioner, you have to be good at marketing, you have to be good at business, you have to be good at communication skills, as far as how to talk to a client, how to manage your client. And so there's a lot involved. It's a very dynamic practice. It's not just going in and just treating somebody. And that's also nice too, because you step out of your box and into another role. And so that really keeps you growing. So I just would say be adventurous, hang in there, and learn different skill sets and see how you can apply them.
Hi, my name is Melissa Kowalski. I'm the Director of Operations over at Integrative Health, but I actually started out here as an intern from Metro. I majored in the Integrative Therapeutic Practices with a minor in biology. Currently what I do as the Director of Operations here at Integrative Health is a wide variety of things. I get to work with a wide range of different providers here, so I'm constantly learning about new therapies. I also work with the clients. I'm here up at the front desk. In addition, I get to do some of the services with the heat and cold laser, as well as some flexion and distraction and any other help that some of the providers may need. I guess what I would say, since I used to be a student over at Metro, is for any students that are considering the ITP major or current students that are in the ITP major, it was such a wonderful program. I think the best part about it was the professors. They were very passionate and knowledgeable. Most of them were teaching subjects that they actually currently work or have worked in that field before. So it was just kind of nice to know they knew what they were talking about, and they really cared about their students. I think just that by itself made it a wonderful experience for me. In addition, it's one of those programs where not only can you use it for your career, but you can use it for yourself. I found that it helped me with my mind, body, and spirit. I also help a lot of my friends and family working with essential oils, homeopathic remedies, yoga, etc. So it's one of those great things that you can incorporate into your own life. And I guess my biggest advice would be, since it is such a new major, it's really exciting, but it can also be scary because there's not a lot of predetermined jobs for that major. So my thing would be, don't limit yourself. If there's not something out there that fits exactly what you want to do, you can, really create a job for what you're looking at. Since it's so new, you can kind of put yourself into all these different career choices or paths. What I learned, it can be addressed to some current jobs, but you can also make it your own. So the world is your oyster, and you can kind of pave the way for integrative therapeutic practices.